It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. When should a dog be dewormed? Dogs are at risk of becoming infected with many different types of intestinal parasites, such as roundworms, tapeworms, and hookworms. They can become infected through several routes, such as other infected animals, their mother if infected during pregnancy, or by eating worm eggs in feces, urine, or infected grass. Roundworms. Roundworms are the most common intestinal parasites in puppies. These worms can be transferred to the puppy by its mother during pregnancy and through her milk. The puppy can also become infected during the first months of life due to contamination of its environment. Also known as roundworms, roundworms can range in size from 1 to 4 inches long. They are usually yellowish-white to reddish-brown in color. Worms can be seen in the dog's feces or vomit. Roundworm infection in dogs can cause a variety of symptoms, including mild abdominal pain, diarrhea, and vomiting. Some puppies with a heavy worm burden may have a bulging belly appearance or experience poor growth, dull coat, and lethargy. It is important to note that roundworms can also infect people. It is essential to maintain good hygiene in contaminated areas or around infected dogs. The tapeworms. While tapeworms are not as common as roundworms, dogs that hunt or are fed raw diets may be at higher risk of infection. A dog can also become infected with tapeworms by ingesting fleas while grooming. Tapeworms are flat and long, more than 15 centimeters long. Tapeworm infection rarely causes serious illness. Some dogs may experience loose stools or other digestive disorders. You may notice small, white, flat tapeworm segments in the fur surrounding your dog's tail and backside, or you may see a string of these white segments in the dog's stool. Hookworms. A dog can become infected with hookworms by ingesting them through contaminated soil, penetration of the worms through the skin, or through breast milk. Hookworms are small, only 3 millimeters long, and difficult to see with the naked eye. They can ingest large amounts of blood from the tiny vessels in the intestines, which can cause severe anemia and weakness in an infected dog. Other symptoms include weight loss, bloody diarrhea, and dull, dry coat. Skin irritation and itching may be noticed where hookworm larvae have burrowed into the skin. When should you deworm your dog? In the past, all adult dogs were dewormed regularly. This approach is no longer recommended for several reasons. We know that each dog will have a different degree of exposure to intestinal parasites. Therefore, it makes sense to adapt your deworming protocol based on your risk factors. Furthermore, there is no scientific evidence to support a fixed deworming protocol. A blanket deworming approach for all dogs increases the risk of worms developing resistance to commonly used medications. Over time, this approach causes medications to become less effective in treating parasitic infections. Based on current scientific evidence, we now recommend that deworming protocols for adult dogs be based on the finding of parasites in fecal tests or if you have seen worms in your dog's feces or vomit. Your veterinarian will likely recommend performing a fresh stool test to test for parasites. These tests can be repeated every 3 months, if necessary. Talk to your veterinarian if you strongly suspect your dog may have intestinal parasites. Puppies are usually dewormed by the breeder or at their first visit to the vet at 8 weeks of age. Elimination of intestinal parasites should always be confirmed with a fecal test. If you travel with your dog, always make sure you comply with local and national requirements for the import and export of pets. What can you do to help your dog? Talk to your veterinarian about the risk of your dog having intestinal parasites. He will be able to recommend you. Dogs that hunt or are fed raw diets should be dewormed monthly. Pregnant dogs should be dewormed during pregnancy to reduce infection of the puppies. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.